Imagine two people. One people exercise regularly, eat healthy food, doesn't smoke and rarely drink alcohol. The other has several unhealthy habits. You might assume the first person has no reason to worry about cancer. But here is the surprising part. Even someone who live a very healthier lifestyles can develop cancer. Why? Because not every cancer risk factor is something we can control. Some are connected to our age, genetic, family history, and biology. Understanding this factor doesn't mean you should be scared. It means you can better understanding your personal risk and make smarter decisions about prevention and screening. Let's start with something none of us can control: age. Imagine two people, one who is 25 and another who is 65. Their cancer risk isn't necessarily the same. As we get older, cells in our body accumulate genetic changes over many years. Because of this, the risk of developing many cancer generally increase with age. That's one reason why certain cancer screening recommendations become particularly important as we get older. You can't stop aging, but you can stay aware of screening recommended for your age group. Now imagine Rahul's mother had breast cancer and his grandmother had a related cancer. Doesn't that mean Rahul or other family member will definitely develop cancer? No. But having several closer relatives with certain cancer, especially when cancer occurs at an unusual young age, can sometimes indicate a higher than average risk. That's why knowing your family medical history can be valuable. If several close relatives have had of cancer, don't panic. Instead, discuss that history with the healthcare professional. They may recommend a different screening schedule or in some situations genetic counseling or testing. Sometimes increasing cancer risk can actually be passed from one generation to another through inherited genetic changes. For example, certain inherited mutations can increase the risk of cancer such as breast, ovarian, colorectal and prostate cancer. But remember, having an inherited mutation does not mean you definitely get cancer. It means your risk may be higher than average. Think of it like a warning sign on the road. A warning sign doesn't mean an accident will happen. It simply tells you to pay more attention. Similarly, knowing about an increased genetic risk can help doctors decide whether additional monitoring or screening may be appropriate. Another factor is biological sex. Certain cancers are associated with productive organs, while some other cancers can occur more frequently in one sex because of the biological and hormonal differences. This is one of the reasons cancer screening recommendations aren't exactly the same for everyone. Your age, biological factor, family history, and other risks can all influence which screening are appropriate for you. There is another group of people who may have different long-term risk profile: cancer survivors. Some people who have received certain cancer treatment may have small increased risk of developing another cancer later in life. But this doesn't mean their original treatment was a mistake. Doctor considered this potential long-term risk against the benefit of treating the original cancer. For the cancer survivor, regular follow-up care can therefore be especially important. Why knowing your risk matter? Now let's imagine Meena. She knows that several close relatives have had a cancer. Instead of ignoring it, she tells her doctors about her family history. Her doctors can then look at her overall risk and determine whether she needs any additional screening or monitoring. This is the real benefit of understanding your risk. And this is where the cancer screening becomes important. Depending on your age, individual risk healthcare professionals may recommend screening such as mammogram, cervical cancer screening, colorectal cancer screening, and lung cancer screening for eligible individuals. Screening can sometimes detect certain cancer and prescribe changes before symptoms appear. You cannot control your age, you cannot choose your genes you inherit, and you cannot change your family history, but that doesn't mean you are powerless. You can avoid tobacco, stay physically active, maintain healthy weight, eat balanced diet, limit alcohol, protect yourself from excessive UV exposure, and follow appropriate screening recommendation.